So if you're diagnosed at stage 3, 4, or 5, which we would say is relatively late, over 5 years, around about 70 to 80% of people will have died, will have passed away. However, if we were diagnosing those patients at stage 1 or stage 2 really early, then around about 20% have died in 5 years. So actually, 70 to 80% of people are surviving. Thailand loses 0.4% of GDP every single year. So, what I would want to do as a strategy is I'd want to invest in the children of the elderly and make sure that our workforce is healthy so they can take care of the elderly.
Please welcome next your session, Mr. Farid.
Sawadee-kap, Kumpang. Thank you very much for inviting me here today. The nation asked for an international speaker, so I thought I'd speak in English instead of Thai today.
I will take some note and maybe I can translate for a short word.
So let me share a little bit about Roche. So this is our brand promise. Doing now what patients need next. So Roche is 125 years old. And we're 125 years old because we're always thinking about the future needs of healthcare. So we started off as a vitamin company 125 years ago. Then we started developing medicines for infectious disease, such as hepatitis, one of the first companies in the world to develop medicines for hepatitis, through to transplantation. And today we're renowned for being an oncology company. So we work very closely with all of the oncologists here in Thailand. However, our portfolio actually is very rich in terms of neurological disease, in ophthalmology. So we're really well positioned to really help meet the needs of the future population. And really excitingly, we're hoping that soon towards the end of this year, we'll have a medicine report out for Alzheimer's disease. Arguably the biggest cause of, if you like, social issues and non-communicable disease when it comes to the elderly as well. So, as I said, we were founded in 1896. We are the #1 investor in research and development in the world. So we're the #1 pharmaceutical company in the world, and we invest approximately 12 billion Swiss francs every single year in research and development. So just to put that into context, Tesla invests around about $2.5 billion US dollars. We invest $12.2 billion last year in terms of R&D. We employ over 1,000 people worldwide, and we actually have 32 medicines listed in the WHO Essential Medicine list. We're a little bit different as a pharmaceutical company because actually we're majority owned by the Hoffmann-La Roche family, which really makes us stand out. So we don't have the same pressures when it comes to shareholder value, which means that actually we can invest in the most difficult to treat diseases because actually the family values are really trying to improve the health of the world and getting closer to cure for many of the diseases worldwide. And just to try and kind of share with you, Roche in 2020 was the first company to develop the test for COVID. And last year we actually tested over 27 billion people worldwide with our diagnostic test. So the world's largest pharmaceutical company and the world's largest diagnostic company as well. In terms of research and development, then our research and development is comprised into 3 main areas. We have research in the US, in California, via Genentech in the US. We have research laboratories in Basel, in Switzerland. And then we have a research partnership with Chugai in Japan. And that's where our 12 billion Swiss francs get spent. In fact, that's around about 32 billion every single day that we're focusing in developing the new medicines. So the physicians at Thai Nakarin Hospital can use them, or Ajahn Pasan can use them as well. And in terms of our late stage into commercial development, then we develop them. So we manufacture them from a commercialization perspective. And in fact, it's one of the areas we're looking at to drive efficiencies. So one of the things we'd like to do over the next 10 years is to bring 3 to 5 times more innovation at less cost to society. So we're actually working really hard to make sure that actually when we develop medicines, we can do it in the most efficient way. So when we price our medicines, we can bring them to society at a lesser cost as well. We're the world's largest manufacturer of biologic medicines. And today, biologic medicines are probably arguably the most advanced medicines when it comes to treating disease such as cancer or in ophthalmology disease for medicine, for example, age macular degeneration. And then we actually are commercialization. So again, in terms of providing medical education to frontline physicians and helping them understand how to use those innovations and those technologies. Again, the investment we put into our medical teams to make sure we can bring those medicines to market is really important. In terms of areas where we're expanding and looking at, then I think data is a real significant investment for us. So we have a data investment with Flatiron, which is the largest database in the US of an oncology database. So we combine our Flatiron database in the US with our foundation medicine technology, which is around making sure that we can use our diagnostic capabilities to diagnose and understand the genomic mutations in cancer. And we're able to combine the data from Flatiron with that genomic mutation data to really help provide artificial intelligence for doctors on a front line to help them understand how to treat cancer tomorrow. And then we've acquired Spark Therapeutics, again, really looking at the future of personalized healthcare and looking at how we can, for example, bring gene therapy to patients in the future. So, as I say, we're focused on personalized healthcare. 12 years ago, we used to think that cancer was a condition related to the cells. We thought it was a disease of the cells. Today, what we know is that cancer, in 12 years, we've come to understand that cancer is, in fact, a disease of the genes. And now we invest both in a diagnostic perspective to understand what those gene mutations are, and then we have combinational targeted therapies to make sure that we can treat those mutations in different tumor types. And this is where we see the future, and we take that future one step further, and we think about gene therapy. This is around taking an individual's genes and their mutations, engineering the right gene to put back in the cell to make sure that that person, therefore, can have a better outcome with their disease. And finally, when we look in Roche Thailand, then in here we've been in Thailand for 51 years. I'm proud to say that we employ over 440 people in Thailand. We invest 600 million Thai baht in clinical trials every single year in Thailand as well. And that we've treated over 2.9 million Thai patients with our medicines over that time as well. So, as I say, we're very proud to have been present in Thailand for a very long time.
In Thailand, we have a cause of death in cancer is the number one. So next round, we're going to talk about this, okay? Next, we're going to Mr. Farid. We say that prevention is a key success for take care of our health. In many countries, next step, we're talking about the screen of the cancer. If we talk about cancer, what the trend and healthcare innovation in the diagnosis, and we talk about the prevention before disease progress.
Yeah, thank you, Kumpang. So it's estimated 1 in 2 people will get cancer in their lifetime. Yeah, so Tanakarin is always going to be in business. But I guess when we think about prevention, we can be really preventative. So we, for example, know that if we've got a family history of cancer, we can actually go for a genetic screen to see if we have something like what we call a BRCA mutation, which is a very rare mutation in breast cancer. In some countries, there's a service called 23andMe, which is they send a swab sample to your home. You take a swab, they profile your DNA, and they tell you whether you have these mutations. And that empowers the individual to then think about, well, okay, maybe I need to go for mammography screening more regular, for example. So at one end, we have the ability to start really early from a prevention perspective. On the other hand, actually, with the governor of Bangkok, we met his team today because we're talking about doing cervical cancer screening in the provinces here. And that is around bringing different innovations. So today we have a diagnostic test where we take a diagnostic sample where we can swab, just like we do with ATK. So that allows women to take a swab, a sample in their own home, in the privacy, instead of having to go to a hospital, and then send the sample off to see if they've got cervical cancer, for example. So again, when we think about diagnostics in the importance of that in helping with screening, again, innovation is becoming, if you like, even more and more innovative in that space. And then, as I mentioned, for people who have got cancer, then again, making sure that we think about the right diagnostic test. So genomic screening is probably the gold standard today. Then bring in artificial intelligence to help understand how to treat that patient. That empowers the doctors and the physicians to make sure that we can deliver the right medication at the right time.
And what are Roche policy to drive in the early cancer screening?
Yeah, so I think it's important to understand and help the public understand why early cancer screening is really important. So if we take something like lung cancer, for example, lung cancer is Thailand's most common cancer, right? If we take lung cancer, it's around about 14 different types of genomic mutations, even more.
40 or
14.
14.
So we know approximately 14 different types of genomic mutation make up lung cancer. But the diagnostic stage of lung cancer is really important. So if you're diagnosed at stage 3, 4, or 5, which we would say is relatively late, over 5 years, around about 70 to 80% of people will have died, will have passed away. However, if we were diagnosing those patients at stage 1 or stage 2 really early, then around about 20% have died in 5 years. So actually, 70 to 80% of people are surviving in 5 years.
Excuse me, I can translate it for this, because this is very important. คือคุณฟาริดบอกว่าถ้าหากเป็นในลักษณะที่ว่าเราสามารถที่จะสกรีนได้ก่อนโดยยกตัวอย่างลังแคนเซอร์หรือว่ามะเร็งปอดเนี่ยนะคะในกรณีที่เจอในลักษณะที่เป็นสเตจที่สูงขึ้นอย่างเช่น 3-4 เป็นต้นส่วนใหญ่ในไม่กี่ปีหลัง 3-5 ปีเนี่ยส่วนใหญ่ก็จะเสียชีวิตแต่ว่าถ้าหากอยู่ในสเตจที่2 1หรือ2ถ้าหากเจอก่อนเนี่ยมีแค่ 20% เท่านั้นที่จะเสียชีวิตจากโรคนี้
So in terms of what we try and do then is we try to make sure that we can bring medicines in what we call the early stage, in the early setting. So for example, proving that targeted therapeutic can be used in what we call neoadjuvant, so before surgery happens, or adjuvant after surgery happens. In those early stages, we're able to demonstrate, for example, now in lung cancer, hopefully in liver cancer, the second most common cause of cancer here in Thailand, that actually we'll be able to improve survival. And then in terms of working with hospitals like Thai Korean on raising awareness around the importance of early screening. So for example, going for an early CT scan for lung cancer or regular mammography checks for breast cancer. These are the things that we really try to promote with our partners, because earlier diagnosis means better outcomes. We can get closer to curing cancer the earlier that we diagnose patients.
Mr. Farid, we're talking about we are going to in the aging society. What do you think that Thai people need to do to prepare?
So first and foremost, it's a really important topic, because today there is statistics show that actually 5 healthy Thai people will look after 1 elderly. Yeah, by 2040. There'll be 2 healthy people to 1 elderly, right? So dependency is a big issue. So actually, I think the topic today has been around how can we support elderly, right? But actually, we have to support the people who are going to look after the elderly be really well, yeah? Because if they get sick, there's a big challenge. So actually, when we think about, and my colleague on the panel said it, health equals wealth, investing in health is actually investing in wealth and the economy. If we look at cancer, for example, due to premature death, Thailand loses 0.4% of GDP every single year. So, what I would want to do as a strategy is I'd want to invest in the children of the elderly and make sure that our workforce is healthy so they can take care of the elderly. So for me, it's not just about taking care of the elderly. You need to take care of this generation.
Take care of the
Yeah,
elderly. Yeah.
so we can look after the elderly.
And if you can say something to the government, what you want to say?
So I would say that the GDP per capita healthcare spend has been 3.6 for the past 8 years. It's been flat. So in that time, in the past 8 years, Thailand has aged, technology has advanced, and healthcare spend has been flat. So if Thailand really wants to be competitive on the economic stage, it has to invest in its healthcare. So you have to increase that investment into technologies that will keep your population more productive and healthier. So invest more.
Thank you very much.